Hello everyone, Folashade Olakami is my name. I am a nursing student from Indiana State University, the Healthier to Be SN program. So today I will be talking about addressing the barriers to health promotion and disease prevention in the rural areas. Before I proceed with this presentation, there is a link to pretest below this video. The pretest link is to help the student or the readers to have an idea of the topic. So the learning objectives for these presentations are: nurses will understand risk factors contributing to the prevalence of chronic diseases in rural areas. Demonstrate an understanding of the barriers to health promotion and disease prevention in rural areas. Develop strategies that will help to alleviate the barriers to health promotion in rural areas. Demonstrate the knowledge of using communication technologies to create awareness about preventative services in rural areas. Collaborate with other healthcare professionals and government agencies at local, state, and federal levels to provide healthcare resources to the rural areas. Diseases and rural community. Chronic diseases are more prevalent in rural areas compared to urban areas. Center for Disease Control and Prevention, CDC, labeled chronic diseases as the leading cause of death and disability in America. People who live in rural communities are more likely to die from chronic diseases such as cancer, heart disease, unintentional injury, stroke, and chronic lower respiratory disease than people who live in the urban settlements. Causes of death and disability in rural areas. Higher rates of death and disabilities in the rural areas are caused by limited access to healthy foods, fewer healthcare specialists, higher poverty rates in the community, less educated population, and cultural and social norms of the community. Center for Disease and Prevention, CDC, 2019 confirmed that many deaths reported among rural Americans were preventable. In 2014, CDC reported 25,000 deaths from heart disease, 19,000 from cancer, 12,000 from unintentional injuries, 11,000 from chronic lower respiratory diseases, and 4,000 from stroke among the people living in the rural areas. What are the strategies to implement changes in rural health? Using the community organization model, community readiness model, and clinical model will help in developing strategies that will address the barriers to health promotion and disease prevention in rural communities. Nurses can implement changes by educating people in the rural areas through the community meeting to improve health literacy, emphasize on the importance of child wellness and preventative services such as vaccine, like influenza for vaccine. Nurses can also discourage cultural and social norms contributing to unhealthy living. Cultural and social norms such as smoking, excessive alcohol consumption, drug abuse, all these are very dangerous to community health. Nurses must recruit people in the community who will work together to gather data and encourage other people in the community that the changes will support healthy living and improve community health. Nurses must motivate people who are involved by compensating them for their time and effort. Appropriate communication channels must be used to relate the message to the people in the community. Awareness through social media by distributing flyers and newspapers, TV and radio advertisements, phone calls and mailing education materials to an individual household will help to educate the community of the recent situation and how to apply changes that will positively impact the community health. Nurses must collaborate with other healthcare professionals such as doctors, nutritionists, therapists to achieve successful outcomes when initiating changes. Working with charity organizations such as food banks and other donation centers will also help in collecting the resources needed that will be useful for people in rural areas. Soliciting for support from the government at all levels will help to promote these changes as well. Soliciting for health clinic closer to the area and transportation service that will help people in the area to have a quick access to the hospital in case of emergency. In conclusion, education is paramount when implementing changes. Many people find it difficult to give up the old habits and embrace the new changes. Educating people about the benefits of changing the old habits will help with the transformation in the rural area. Involving people in the community in the plans will facilitate effective changes. Access to transportation service, healthy food, clean water will prevent and reduce diseases in the rural community. Soliciting with government agents in all levels to build clinics in the areas will also go a long way in preventing untimely death and disability among the people in the rural community. Many of the strategies mentioned above and many others will help to initiate the changes that will eliminate the barriers to health promotion and disease prevention in rural areas. This slide provides more information about the barrier to health promotion and disease prevention in the rural areas. The website for Center for Disease Control and Prevention has more information about how to promote healthy living in the community. Thank you.